Welcome to Health Talk. I'm Ron Schakal with Shannon O'Kelly, president of IRG Physical and Hand Therapy. And Shannon, let's get right to our first guest. It is Dr. Kimberly Costas, medical director of the thoracic surgery at Providence Regional Medical Center in Everett. And she's talking about Lung Cancer Awareness Month.
That's right, Ron. November, Lung Cancer Awareness Month. Again, this is one of those cancers that if early detection via screening is caught, the survival rate is increased. Dr. Costas has a ton of information regarding lung cancer.
Here's Dr. Costas and Shannon O'Kelly.
Dr. Costas, welcome to Health Talk here on Como Radio. How are you today?
I'm great. How are you? Thanks for having me.
Oh, thanks for coming back on. Your practice at Providence there in Everett focuses on thoracic or cardiothoracic surgery, but your specialty is lung cancer and lung cancer surgery, and more importantly, really trying to get the message out for lung cancer screenings. And it's one of those cancers that we don't talk about much, but we can screen for it. And here it is, November, which is Lung Cancer Awareness Month. So let's talk about how important it is to screen. The show's yours right now.
Thank you so much. So lung cancer is actually the third most common cancer in the United States. But even though it's the third most common lung cancer, it's the number one cancer killer. So it kills more patients than breast and colon and prostate cancer combined. And part of the problem is that lung cancer presents in advanced stages because most of the time there are no symptoms associated with it. So our goal to try to improve those statistics is to find patients early in their disease so that we can treat them for cure.
You know, I don't know about the screenings. The general public doesn't know that you can be screened for it. It's a pretty simple screening. Let's talk about kind of why there's a lack of maybe knowledge about screening and why people maybe don't get screened. And let's talk about who should get screened.
Absolutely. You know, lung cancer doesn't have a blood test that you can use for screening, like prostate, where you would check a PSA or something like that. The screening for lung cancer is done with a low-dose CT scan of the chest. And there was a very prominent study that was published in the New England Journal of Medicine that showed that using a CT scan to screen for lung cancer improved survival for lung cancer patients. Actually, fewer patients died because of lung cancer screening. And the way that we run that program is to screen patients who are considered high risk. So those high-risk patients are patients who are between 50 and 80 years old, patients who have smoked 20 pack years. What that means is you've smoked one pack a day every day for 20 years in a row. And patients who are currently smoking or who have quit in the last 15 years. Those are considered high-risk patients. So if a patient falls into that category, we would enroll them in our lung cancer screening program, and then they would get a low-dose CT scan of the chest as a baseline screen. And if there are no findings, we would continue to screen them annually as long as they met the high-risk criteria.
If I'm a listener right now, how would I gain more information? Who could I talk to? Who could I reach out to if I have a concern or I want to be screened? Can you give us some contact information?
Absolutely. So for the Providence Medical Group in Everett Lung Cancer Screening Program, we have a specific intake phone number, 425-297-5864. There's also a number of really excellent websites. The Providence North Everett website has a lung cancer screening page. But I also really like this website. It's called the Go2 Foundation. And that's GO2 foundation.org. There's a lot of excellent information on that page, including where to get screened, including Providence Everett.
Fantastic. Dr. Costas, thank you so much for your information and for your passion in treating lung cancer. I mean, it's a cancer, again, caught early, survival rates. Get screened if you need to. Have a great day, Dr. Costas.
Thank you.